If you have discoloration in your skin, you don't have to just accept it or keep covering it up with makeup. How would you like it to go away for good? Well, living in Florida, it's pretty much inevitable that we're going to get sunspots. But our next guest can take care of that. Dr. Charles Couture from TLC Aesthetics joins us now to talk about IPL. Good to have you here, Doctor.
Thank you.
I've heard about IPL. What is it exactly?
IPL just stands for Intense Pulse Light. All it is a light-based device that we apply against the skin. It can be the face, the hands, the back, and it basically takes care of pigment. So brown spots, blood vessels, rosacea, acne. We
have some before and afters, and I want you to tell us what we're looking at in the first one. This woman, I see some brown spots there in the before shot. Now, would that be sunspots?
Yeah, this is just, what we call solar lentigo, fancy word for age spots, and you can see the brown spots in the bottom right portion. And then you see the after, and it's basically gone away.
How many treatments would that take?
Each person, it varies, but we're talking on average about 3 treatments to get a really good response.
That is amazing, because they are gone. A lot of people just think, well, it's just a part of aging. I have to live with it, but you don't have to live with it.
No.
Now, what about skin types? Because, you've got all kinds of different skin types out there, and there are some people who shy away from any kind of laser at all if they've got darker skin.
Sure.
So does IPL work for everyone?
So, unfortunately, no. It's good for the lighter skin types. We call them skin types 1 through 4. The darker skin types, like myself, 5 or 6, you can't do this treatment, but we do have alternative treatments for them.
Okay, now we have another before and after to look at. We have a gentleman here. Tell us about what you did for him.
So this gentleman had the typical signs of aging with a lot of those brown spots, and he had a lot of broken capillaries or blood vessels. And we did a series of 3 IPL treatments, and you can see his face is much clearer overall.
That's incredible that it works on the capillaries as well. That's good news for a lot of people who think they just have to live with it. Now, what about for younger patients as well? I know that our next before and after, I think, is a girl that had some acne issues.
Yes. This is a patient who actually went to many other providers and tried many things over the counter and antibiotics, etc. It didn't work. We did several IPL treatments, and as you can see, she's got at least 90% reduction after that.
That is incredible. What does it feel like? What do patients feel when they get it done?
A lot of these folks, they're scared because they see it's like a flash on a camera, so just think of that, but it's magnified a lot brighter. So that scares people sometimes, but it's really not that bad. And some people akin it to like a rubber band hitting the skin.
Well, that's not so bad.
Yeah, a little discomfort, but it's not the worst thing you've ever had.
Can you go back to just regular living the next day?
Yeah, in fact, we can do this over lunchtime. You'll have a downtime, maybe 20 minutes. Maybe by the time you eat dinner, some of the redness maybe look like a mild sunburn, and you'll be fine after that.
So you can treat the capillaries, the acne scarring, any kind of brown spots, and don't forget about the hands, right? Because that can be a dead giveaway.
Hands, the décolleté, which is the area on the upper chest. You can do it on the back, your legs, anywhere you have these.
Possibilities are endless. Now, do you have some specials going on in December?
Yeah, we do. We have 50% off our regular pricing for the IPL, and also our Botox is 50% off.
Wonderful. Okay, well, for more information, if you want to find out more about how you can do this from TLC Aesthetics, make your appointment and get more information by logging on to BotoxFun.com. Or you can always call 813-874-1TLC. Doctor, thank you very much for coming in.
Thank you so much.
I think this is
good news for a lot of people.
All right, thank you. Daytime, we'll be right back.